What we've done since then is we've tried to understand a number of issues about the men who progressed. Who are they and what were their characteristics? And the other question we tried to address is we used treatments which were available in the late 90s and early 2000s. Treatments have moved on, they've changed slightly, so surgery has changed now in that open surgery is not done as frequently and it's mostly robot-assisted surgery. Radiotherapy has changed and it's now no longer 3D conformal, but it's intensity modulated radiotherapy. So there were arguments that because the treatments that we used in the trial were a little bit old, they may be antiquated, and results, if we had to repeat the trial with new treatments, would be different. So in answer to the first question, what were the characteristics of our men? When we published our original baseline data, many people thought that the cohort of men that we had were low-risk disease because 77% had Gleason 6. But in fact, when we looked at it more carefully now, and these are unpublished data, we find that 58% only of the men had low-risk disease and 40% had intermediate-risk disease. And there were even men with high-risk disease, about 2%. So it is incorrect to think that all the cohort is low-risk, and we need to adjust our thinking about that and examine these patients more. The second question was, what are the characteristics of these men? And what we found is, for example, that 53% of men who had progressed, 204 men progressed compared to 1,411, 53% of these had baseline characteristics of low-risk disease, but this was on biopsy. And on the other hand, when we looked at the men who received surgery, we found that none of the men who had really low-risk disease on pathological staging and grading progressed. So what does that mean? Does it mean that low-risk disease doesn't need to be treated? No, it doesn't mean that. What it means is that if there is low-risk disease and patients receive treatment, then they don't seem to have any progression at all. On the other hand, we found that some patients with intermediate-risk disease didn't progress. And this also came as a surprise because particularly the high Gleason, so 4+3 Gleason, have a tendency to progress, and the recommendations that most clinicians make to patients with intermediate-risk disease now is that they should consider radical treatments.